My business is physical therapy. I have been a physical therapist for 10 years, and my business is outpatient physical therapy with the specialty of scoliosis treatment and treatment of runners. A year after I started practicing, I saw a patient that had scoliosis that her mom asked me if I did a specific treatment method for scoliosis. And I told her I didn't even know what she was talking about, the method that she was talking about. So I researched it, and there's a book online that you can get. It's called the Schroth Method. So I bought the book, read part of the book, didn't understand the book, and it sat on my shelf for about 6 years. And when I finally decided to break out on my own, it had always been in the back of my mind that, there's this population out there with scoliosis that is very underserved. So why not fill the gap and make that one of my niches? And I thought it was just going to be a small niche that, we could at least help some people that have scoliosis that weren't getting treatment for it otherwise. I didn't expect that it would be more than 50% of my practice. I wanted to be able to offer something other than just wait and see if it gets worse, which is historically how it's treated. So we're trying to change that up. I had worked for a corporation for about 8 years, and I always wanted ownership. And the corporation that I worked for kind of took that ownership possibility away, and so I wanted to continue that dream of owning a clinic. And so I broke off after 8 years with them and decided to start my own clinic. And I live here in Lehi, so I decided why not start it where I live? And that's pretty much it. With student physical therapists, we work with the University of Utah and Rocky Mountain University down in Provo, and we take their students. But the one I have right now, John, he's actually from Eastern Washington University. And it works great. It keeps me on my toes because I have a student that's in the clinic that may ask me any question at any moment. But, we have to just keep things current. And they actually help me keep things current because they're, in school you're kind of at the cutting edge of what's being done, hopefully. So it's been nice. So my favorite moment, coupled with my greatest accomplishment, it actually happened 2 weeks ago. I got a text on my phone from a patient's mom that told me that her daughter had hit a home run that day. And I was like, that's amazing. And the backstory on this is that this patient had been having shoulder pain and wasn't able to play softball for a year, and had seen multiple surgeons, multiple physical therapists, and hadn't had any relief. She was in pain all the time, wasn't able to play. And one of my good friends saw that she had scoliosis and referred her down to see me. And once we started working with her scoliosis, her shoulder started to get better, and she got back into throwing. I wasn't actually aware that she was back on the high school team, but it was really cool to see that she had hit a home run, like just out of the blue. A text just came. That's what makes it worthwhile to me. That was pretty cool. There have been quite a few failures in the last 10 years. I directed the clinic before this for 8 years, and one of the failures that I'll always remember is we worked a lot with the multiple sclerosis patients, and we had this big thing from the National Multiple Sclerosis Foundation that was a good program in working with these people, and we were really excited to work with a big group. So we set a time and we let everyone know that we were doing this multiple sclerosis kind of like workshop type thing, and we let everyone know. We thought everyone was just going to come. People were going to flock to it. And that morning we get up and go to the clinic, and we're all ready to go, and one person showed up. and it was a patient that we were currently seeing for multiple sclerosis. She's looking around like, where's everybody else? We're thinking the same thing. We set a time and we let people know. So that was a little bit of a failure, but a big learning experience. Learning that just setting a time and telling people what we're doing isn't enough. We need to follow up with people and get the word out in different ways. And it was a good learning experience, and it wasn't my business at the time, so I guess that worked out okay. The biggest challenge by far in this clinic has been insurance. When we first opened, insurance is something, getting on insurance panels and in network with insurance companies was a big challenge, because a lot of people like to use their insurance benefits. And without being able to bill in network, it was hard to get a lot of people in. But we've been able to overcome that by being pretty diligent and being the squeaky wheel with a lot of these insurance companies, and just not stopping when they say no to us being on their panels. So we're constantly having issues with insurance companies, and I don't think that's going to be a challenge that we'd fully overcome ever. I mean, especially with the health care climate that we're in, but we're working on it. The biggest thing that I'd probably do differently is I would have built systems early on, so that things that work well are done consistently. The same way every time. The more systems that we can get in place, the better. That would have been, the smoother it would have gone over the last 2 years. But we're learning and we're implementing systems now as much as we can. The biggest one is to know your numbers, know what it takes to get, in my profession, what it takes to get one patient through the door. Know where your break-even point is. Know where your expenses are. Know all those things. And then that makes it a lot easier to determine whether or not what you're doing is effective or not. So you're not wasting money, and you're doing it a little bit more scientifically in how you're marketing and doing other things. I love interacting with people. That's what I love the most. I hate paperwork and I hate dealing with insurance companies, but I love being able to associate with amazing people all day long. No day is very dull when you have that variety of people. It makes it really fun. I get a lot of fulfillment out of my job. And I think when I worked for somebody else, there was always something in the back of my mind that wasn't getting fulfilled by working for somebody else. And I remember specifically when patients before would ask me, "Oh, so is this your place, or is this a franchise, or do you own this?" And I would be like, "Well, no, I'm just an employee." It was kind of weird because I always felt bad about that. I'm like, "Oh, I'm just an employee." Now I don't have that. If somebody asks me if this is my business, heck yeah, this is my business. And there's a lot of fulfillment in that. It's really nice. Well, my family motivate, just being able to support them and being able to, give them the life that I want to give them. That's a big part of it. But then the other side of it, being able to offer treatments to people that might not get those treatments other places, like with scoliosis, or specific treatment for runners and triathletes. Being able to offer those services and knowing that that's kind of our niche, and knowing that specifically with scoliosis that people can't get that anywhere else.